Well, good morning, everybody. This is your Health Reclaim podcast where we uncover the root causes of Lyme and chronic illness and explain really what's going on with people so they can finally heal and reclaim their life. We got together a guest with us today, Dr. Brett Hill, who's got some really unique ideas and a unique approach to things that is not commonly talked about at all. And they're absolutely essential cores to how we function, how we move, and all of our neurological issues. So this is Dr. Brett Hill. Thanks for joining us today.
Thanks, Dr. Brad. I appreciate you having me. I'm excited.
Yeah, so we had just got into what got you into what you do right now. So why don't you back up and share with that? Because this is not a typical route that chiropractors do. And it's too bad. It's really too bad how often we miss the pearls and the foundational things. We just want to go for something else.
Yeah. Well, you're exactly right. I think going back to the baseline of where it all starts from. I mean, to be honest, originally I wanted to go to medical school. I think I'm going to help people with all these problems. My mom had health issues and I'm going to solve them. And I found I didn't want to just prescribe a pill for this and a pill for that to cover symptoms. I wanted to do more. And it resonated more with the chiropractic idea of helping the nervous system so the body can heal itself. But the more I learned about the neurology of how it functions, the more it drew me into wanting to help people in a faster way and more impactful way, which is why I started my practice out of school when I graduated. And
did you start from scratch, or did you buy another one?
I started with 0 patients right from scratch in like a 200 square foot room where I just was confident in what I'm going to do is going to change the world. We're going to impact people differently. And I had an option. A chiro wanted me to come take over eventually his practice, but it was a kind of a high volume system. And I felt like I wouldn't be able to do the things I wanted to do. So yeah, I went with nothing.
So with that high volume system, was that a great room, bunch of tables in one room, and you?
Kind of, yeah. It was kind of, he had 2 rooms where you just go back and forth, and it was just 2 minutes here, 2 minutes there, and quick adjustment styles, and that can be effective. But I'm like, we can affect that nervous system in such a different way, more impactful way, get results that help change the body and the brain. Neuroplastic changes can happen in anyone, and when we can get that, then it empowers them to not be reliant on the drug or be reliant on the adjustment or the massage or whatever it is.
You just said a word that it gets thrown around in healthcare circles quite a bit, but a lot of people don't understand what it means. This whole concept of neuroplasticity.
Mm-hmm.
Can you, clarify a little bit more what that really means? Because this is an eye-opener for a lot of people. They think they're stuck with what they have, and this blows that out of the water.
For sure. And the old theory and thought process was, oh, well, you've had a stroke. Well, it's just damage. It can't ever be repaired, And so that's completely wrong. As we see, there can be adaptations in the nervous system. This neuroplastic change is basically, if you activate a nerve in different ways, it's going to adapt to whatever stimulus you give it. Really, the brain and nervous system, they need 3 things for survival: oxygen, glucose, and activation. So when it's got the blood flow and the nutrition and oxygen in there and glucose, we just need to activate it in different ways, and it's going to develop these neural connections. They're called synapses that basically it can either regrow or go through different neural pathways if there's damaged nerve tissue or other things, to build these firm connections and learn new patterns of movement or control. It becomes almost unconscious. If you look at athletes that do repetitive things over and over, these neuroplastic changes, they could just think about, shooting a basketball, let's say, and the nervous system's going to kind of light up in those areas that would motor control the arm, shoulder, wrist to do that, because they've done it so many times.
There was a study about that done a while ago, quite a while back, that I thought was absolutely amazing. A coach took his team, split it into two groups. One did drills, and the other group mostly did visualization with some drills. And at the end of his period of time on the court, there was almost no difference in either one. That's really amazing thing. The other thing in what you're talking about, I don't think people are really aware of this, but if you look at our nervous system, central nervous system, there's as many nerves in that as there are trees in the Amazon forest. There's as many connections between nerves as there are leaves in the Amazon forest. One nerve can have up to 10,000 connections. And that's insane. So what you're talking about is increasing those connections by what you're talking about activation, correct?
100%. And it's crazy because we really don't utilize very much of the brain power. We're still learning a lot about it, but like for how many nerve connections we have, we're only utilizing a small portion of our brain in our daily lives. And there's a huge potential there to unlock a lot more. But yeah, that neuroplastic changes is really, it's really key for our health in all aspects. And that's what we were finding. We found at the root of a lot of the problems, people were sitting so much at a computer, looking at their phones, not being active, and the tension they would get in their shoulders, the headaches they were getting, the back pain, the torn shoulder injuries, related foundationally to adaptations their body had done, or these neuroplastic changes that caused their body to be deficient in performing in other ways, or being chronically slouched forward, and affected their posture ultimately, which unconsciously your brain and body is doing exactly what it's supposed to do. When we look at a screen all the time, or our phones all the time, it gets really good at looking down, using our visual system, adapting. So, if your listeners probably can't see me, but as we look at a screen, our head tilts forward. We tighten up these muscles at the base of our skull. And these muscles are mainly just designed to balance our head and our balance system, our vestibular system. But as they get overactive all the time, it changes the vestibular sense of our balance, and that changes our postural tone to then change our lower back kind of sway, and we shift our hips forward. And now we widen our stance to improve our balance. All of these things are just neuro adaptations to what we are telling our brain we need to do all day. And the more we sit, the more we look at screens, the more it gets good at that, at the sacrifice of something else.
It's interesting watching you on the screen while you're talking, because you're consciously aware of posture, and anyone who understands what you're talking about, your shoulders don't slump forward, they're back like they should be. Your chin's more back like they should be. And when you get somebody in that kind of position, all your traps and everything else relaxes. And what you're talking about, the classic cell phone or computer posture, as the chin goes forward, it cuts the blood supply off, going up through the hole that goes inside the head, and you're actually depriving your brain of oxygen, blood flow, exchange of nutrients, and all those things. And people don't talk about that.
Exactly. And it's micro strain that happens and adapts over, hours each day. Days and weeks turn into months. Now years go by, and we have chronically just slowly adapted to this, to where it becomes our new normal. We don't actually sense this shift or change because that's now become normal for us. It's kind of like first time I put on a wedding ring, I would play with it constantly. But eventually, if I had to take it off because I was playing a sport or something and didn't want to injure someone, I would sometimes forget whether it was on or off because my brain just adapted to, it became normal to have that on. I didn't even sense when it was on or off anymore. It adapted to that. And so our nervous system just adapts to this new posture, and we don't even know how to change or fix that because we don't even notice that we're out. You make a good point. It cuts the blood supply from the back of our head. It also decreases the rib expansion. So we have less oxygenation filling through our lungs. The one joint that should move 24/7 is our rib joint. And that's really important. So when we slouch our shoulders forward, we're not expanding and getting as much oxygen or blood flow through there. We're also less sedentary when we're sitting and not moving, which then means our frontal lobe isn't activating as much because just by loading against gravity, so meaning standing in good posture, our joints of our spine now get activation to resist gravity, the muscles that suspend us, and they fuel the prefrontal cortex. So this frontal lobe in our brain, which is really important for our health areas to be able to recognize what's stressful or not. And that gets into a whole nother world of stress, anxiety, and how we hold that in our body, how we perceive stress, and this immediate kind of recognize, well, why did I overreact on that? Well, it's because we're not using that frontal lobe very well. And that can relate a lot to how we've adapted posturally to stressors, to our daily work, all of those things.
And you add on that one other factor that people don't really realize. At rest, a sedentary type of a job, your brain's using 20% of your oxygen. When it's thinking hard, it's like 25. When you're exercising, it goes more to the body wall. But it's that much of an issue, and what you started with the posture you're talking about depletes that oxygen supply. And there's even more. And there's just no way for the brain to be able to function very well, which that's where we start off with this stuff. Is that this stuff is so foundational that almost nobody talks about it anymore. And
it almost, you're right, and it almost seems too simple. We know I should sit up, or, oh yeah, my posture's not good. But when you get down to what is really going on, that foundational aspect of how it affects our nervous system, then we can actually address the root of these problems, going back to take out those layers. I mean, when we look at an infant, it's important to understand how they develop. You know, we're born to be healthy. We're born to react to our environment and take in all that information. They develop their brain by just soaking everything in. But, you know, when they're born, we say give them tummy time. It's really important because it develops the curves of their neck first, and they start to look up. Then once they get more core strength, they go on their hands and knees, and then they start to crawl, and they develop cross body and brain development. And once they stand, once gravity is now acting on them in an upright position, all the joints of our spine, which is a lot, and down through our hips, knees, ankles, start to fuel that frontal cortex, that frontal lobe. And now we start developing these higher center learnings of speech, fine motor control, reasoning, problem solving skills. But fundamentally is that postural tone. And as we lose that postural tone, we sit more, our hamstrings shorten, our hip flexors shorten. We let the chair resist gravity for us. We're not having to use the spinal loading against gravity and the muscles that fuel that frontal lobe, that important decision making. And so we become, you know, foggy brain, more fatigued, all of these things. And we can be more anxious. And it's like a lot of our health issues, if we just focus on that fundamental aspect of correcting our postural tone, our nervous system's going to improve, our stress regulation's going to improve, because we start to recognize, why am I holding my shoulders tight all the time? Why am I not taking in a deep breath? And we have more body awareness to correct these things. We see amazing changes and empowering people to take control of their health.
Yeah, it's interesting. You talk about breathing, how we've lost touch of what normal breathing is like. There's so many people that don't understand what abdominal breathing is, what chest breathing is, how the ribs need to raise up to increase the volume of the lung capacity and drop back down. I remember way back when in grad school I had access to all the measuring things for breathing, and we were able to increase people's ability to exchange volume 40 to 50% just in clearing out and fixing all this rib excursion. Things along that line. Absolutely an amazing thing.
And you think of how many breaths that we take in a day. You know, these are all things, most of the diseases and problems are chronic problems, chronic diseases that have built up over a period of time. And it's not as easy to just say, oh, do this one thing and that'll fix it all. because, yeah, it's this adaptation over micro strains in the body and nervous system that it takes time to reset and rebuild at the foundation of it. But that is really important.
It's interesting what you're talking about, because when you look at chronic health issues, Dr. Bland, Jeff Bland, he came up with the 4 different things that goes on with chronic health. First is things don't resolve on their own. It's not like a common cold. Second, it gets worse over time. The third one is there's a multiplicity of causes. Everybody thinks there's a magic bullet for the one thing they think is causing it, and it's always a multitude of things. You can't fix anything with doing one thing. And you're bringing something into the picture that, I've said it a few times, nobody addresses this. And I think it's really a brilliant, amazing thing. It's obviously really working well for you, and that's awesome.
It's something where, as I started in my practice, and I found I'm giving these patients a lot of the similar things to try to address their root of the problem. And I'm like, well, it goes back into deeper layers of their postural weakness, core weakness. Honestly, posture relates to so much, like our balance control. We'll give eye exercises depending because they are weakness in certain eye muscles because they lean forward too much and have adapted with a head tilt and different things. But when we found we're giving a lot of these same exercises, that we put together this program, we call it the posture program. But it gets to the root of not just, I need to sit up straight, so let's pull our shoulders back. People that do this all the time, they're like, oh yeah, I need to do this more. I'm like, actually, no, that's not good posture. Pulling your shoulders back just increases the stress response in the traps and tightening up your big mover muscles. Posture uses small, unconscious muscle control groups that are tricky to fix because we don't actually know what it should feel like. And
it's like what you just said about pulling the shoulders back. They should be pulled back with the lower traps, not the upper.
Exactly. And what's important is the head. The body follows the head. There's so many receptors through our cervical spine. The majority of the facet proprioceptors, that just means your brain senses where the body is in space. Huge portion of that comes from the mid-cervical spine and the muscles at the base of our skull that keep us aligned. And so if that's forward, it causes everything else to compensate. Our vestibular system and the ear canals will adapt, and it's always giving feedback as to where our head is, and the body will adapt to that. So the first thing we work on is correcting our head position. And when we do it, people actually should feel the tension in their lower back because of the way the muscle system works in our spine. And so it's neat that way, where it's these subtle changes that people make that they start to feel, I don't need to work really hard to correct this. I just need to know what to use to correct this. And then it applies in every movement they do, whether it be running, working out, sitting in their car driving. If they just focus on these muscle groups, they'll breathe better. They will be aware when they start to feel more tension from stress. They'll start to correct and look better because they're not developing that hump at the top of the shoulders. And these things that, again, it affects our nervous system in a very detrimental way. It improves, by correcting our posture, improves the energy, our thinking, our breathing, our sleep, a lot of things. And so this program we take people through starts first with the head, then we work in the core, then we work in the shoulders, then we work on balance and coordination, and we keep building upon it step by step so that they can actually get control and awareness. And what's really cool is in this program, we do a professional assessment of their posture at the beginning and at the end. And they're amazed a lot of times of, wow, that was a huge change, but it was these slowly, daily little things that they're doing. They don't notice that all of a sudden, like they've made that kind of a change.
Yeah, a lot.
And so it's really cool to see
that way. It's the thing that's really, really amazing with what you're talking about. If you do a pinch test on your upper traps, once you start holding the posture like what you're talking about, you can bend forward at the waist so your upper body's parallel with the ground and they're still relaxed. that's something that people just don't get. But once you train your body to fire all those things, it's always more relaxed.
That's so true. That's really cool. But you're right. What you said, people just don't realize and don't get that. And I understand because we just go and do our day-to-day stuff. But it's the things we do today, the little things, they micro build. And if people were to see themselves 10 years from now, 5 years from now, these little things we're doing will make a huge impact.
Yeah, they do.
And so
do you have this program like online for people?
I'm glad you asked that. Yeah. So yourpostureprogram.com is what we've set up where we take people through this program. So the first step we do is we can even do this professional assessment. It uses an app, but they just have to take a picture from the front and then the side view. We analyze it and then we'll meet with them over a video call and go over those results. And then once a week, we meet with them to go over the exercises that they'll get in this program as well. So they'll have access to all the videos that we do, but we want to coach them along because people may think they're doing it right, but it's hard to feel what does posture feel like. Good posture. It's not just pulling the shoulders back. And so the little corrections that we make are really key. And that's where on those video calls, we do those corrections and then we go to the next week and we slowly build. But it's been amazing. This program online has transformed people to reclaim their health, regain energy, and makes a big difference.
Yeah, I can see where that would. So I'll put that link in with the show notes so people can get a hold of that.
I appreciate that.
Yeah.
Well, and one of the things we can offer them too, if they want, we can give them the first 3 basic exercises that are simple to do each day, but kind of give them a taste to try to start improving right away. We'll give them those exercises to start doing, because if they start now, they'll start to develop a feeling of where it should be. And we also, if they want to sign up for our email list, we give daily tips and different things that are easy for people, but nobody thinks of and can make a big difference. So we'd love to offer that for them.
All that's on that same link?
Yeah, I'll give you it'll be a special link for your podcast listeners. We don't give that out to everybody.
Okay, so why don't you send it to me and I'll hook that in with everything. So we're a bit over, so we'll end this one. This has been a great talk. Thanks for coming.
Thank you for having me.
Yeah, this was really good. So we'll check in with everybody next time. We release these every Monday and Thursday. So until next time, thanks. Bye.
Thank you.